How to use a pacifier correctly. If you're a parent wondering how to use a pacifier safely and effectively for your baby, you're in the right place. Let's break down the steps and guidelines to ensure your baby gets the most benefit from using a pacifier. First, it's important to introduce the pacifier at the right time. For breastfed babies, it's recommended to wait until breastfeeding is well established, usually around 1 month of age. This helps prevent any confusion between the pacifier and the breast. When choosing a pacifier, make sure it meets safety standards. The pacifier should have a firm shield with ventilation holes to prevent suffocation. The shield should be at least 1.5 inches across to ensure it cannot be swallowed. To introduce the pacifier, offer it when your baby is calm, not hungry or tired, and swaddled. Apply gentle pressure in the middle of the baby's tongue, then move the pacifier in circles around their mouth. If your baby becomes frustrated, stop and try again later. Sometimes, applying a bit of breast milk or formula to the tip can help. Ensure the pacifier is clean and sterilized regularly. You can boil it in water for 15 minutes or use an antimicrobial agent like 0.12% chlorhexidine to keep it hygienic. It's crucial to follow safety guidelines. Avoid attaching strings, cords, or any other attachments to the pacifier, as these can pose a choking hazard. The U.S. Consumer Product Safety Commission prohibits such attachments. For sleep, pacifiers can be very beneficial. They can reduce the risk of SIDS, sudden infant death syndrome, when given to newborns for sleep. However, do not reinsert the pacifier if it falls out once your baby is asleep. Keep the sleep environment safe by ensuring the crib is free of blankets, toys, and any other items that could pose a hazard. Use a one-piece pacifier design, which is safer than multi-piece options that could break apart. Regularly inspect the pacifier for any signs of wear or damage. If it shows any structural wear, it's time to replace it to avoid any safety risks. In terms of long-term use, it's recommended to reduce or stop pacifier use in the second 6 months of life to reduce the risk of otitis media, ear infections. By following these steps and guidelines, you can ensure that your baby uses a pacifier safely and effectively, providing them with comfort and reducing potential risks.